70% of Lebanon's Syrian refugee population lives in poverty. Ali Mohammed El Dardan is one of them. He also lives with chronic diseases. The cost of care is high. Non-governmental organizations run clinics like this one for those who can't afford treatment or medicine. But not everything he needs is available.
I have cancer and diabetes. I also have heart problems. I need my medicine, but they are no longer providing it. The help has dramatically decreased, and we do not know why.
The lack of money is why. At the same time, the needs are growing. Up to 4,000 patients come to this clinic every month.
We are unable to secure medicine consistently for these people because we don't have the financial support. We don't have the exact number, but around 20 to 30% of those being treated at this centre don't get the medicine they need.
The UN does provide support through a network of 40 hospitals across the country, but it received 38% of the budget it requested this year.
The UN Refugee Agency also complains about donor fatigue. There are 1 million Syrian refugees registered with the UN in Lebanon, and at least 180,000 of them suffer from a chronic disease.
Budget cuts mean some don't get continuous treatment. The UN says at least 25% of nearly 200 refugees with kidney disease have been affected by this.
There are still number of conditions that is not covered within the scope of the program. You speak about chronic conditions like thalassemia, blood conditions, certain cancer conditions. Those of extremely high cost and of complicated is still having challenges to receive the necessary care.
Another challenge is reaching health centers. Refugees are too poor to pay for transport. That is why doctors regularly visit camps. They treat common illnesses, but they also try to prevent disease outbreaks and complications, which have resulted in deaths.
You have many other diseases that cannot be covered and no one is covering, which increases the rate of morbidity and mortality against Syrian refugees.
9 years into the largest refugee crisis, and help is being reduced. Aid agencies are forced to prioritize, which means the needs in the health sector are not always covered. Zeina, Khodr, Al Jazeera, Bekaa Valley, Lebanon.